Director of Curriculum Instruction for FBI-LEEDA, and I also do part-time work in the training cadre. FBI-LEEDA is dedicated to the art and science of developing and building better leaders. And during this coronavirus pandemic, we're going to try to continue to bring educational outreach to you, especially through the month of April. That said, what a perfect topic to start off our April webinar series with, supporting first responders during the coronavirus pandemic. Our presenter is Natalie Summit, or Natalie J. Summit, excuse me. She is a licensed professional counselor. She currently works as the lead counselor and first responder specialist for RiverSource Addiction and Treatment and Recovery in Arizona. And she has her own LLC within Reach Summit Counseling. Natalie comes to us with a Bachelor of Science degree in psychology, magna cum laude from Arizona State University, and a Master of Counseling with the practitioner option also from Arizona State University. Also, part of her background is having spent 20 years with the Scottsdale Police Department as a police crisis intervention specialist. And so we have a person here that has really dedicated her entire life to working with police departments, and in the life after policing, working with us as first responders and dealing with a whole host of addiction and emotional issues. And so here we go. We've got jobs, fire, police, EMS that are always stressful under the best of circumstances, and now we add the coronavirus pandemic to it. So with that said, I think we've got the perfect person to lead this discussion. And Natalie, I'm going to turn it over to you.
Hello, thanks, Neil. I am Natalie Summit, and I am a professional counselor in Scottsdale, Arizona. And yes, it is sunny and very pleasant outside right now. Last January, I did retire from Scottsdale Police Department. I had a blessed career, and I was very fortunate to find my purpose and meaning very early in my career as a police crisis intervention specialist. While I provided crisis services to the community, I also taught at the local law enforcement academy. I served on the SWAT CNT team as a mental health professional, and I created and co-created multiple community policing-based programs and collaborations that are still operative today. Additionally, I presented at numerous law enforcement conferences as a subject matter expert. Some of my topics are crisis intervention training, moral injury, mental illness, special needs, just to name a few. I am genuinely grateful for the citizens I served and the peers I worked alongside. Today, when I drive through my community where I served and lived, I see all the calls for service that I responded to, and all the death notifications that I provided, and all the cases, person and property crimes that I participated in the 20 years. So I can't leave my home without being reminded of what I was able to offer my community and make an imprint. I retired to the date of 20 years. It is important to note that during that last year, I knew it was time for me to move on. Everything that I'm sharing in my introduction will come up later as relevant when it comes to the information I'm sharing. There was a healthy shift in me personally, and I realized that I had had enough in my career. I was tired. My body and mind had become somewhat disconnected. Call-outs and long calls were becoming more and more difficult to rebound from. And for me to remain healthy, I needed to be grateful for all the experiences, and I needed to find new meaning and purpose in my life. And still, thankfully, even at 60, I had energy to do that. Even though I had also experienced multiple traumas on the job, and even some common, frequent institutional betrayals in public safety. This is not uncommon for those in the first responder field. I'm an advocate for all civilians, standing behind and propping up the first responders in the field. I'm a realist, I'm an advocate, and a cheerleader for human potential. often outspoken, but hopefully fair and respectful. And I hope to bring that forth today in this presentation. In January of this year, I started my own business, which is Within Reach Smmit Consulting. I focus on first responders, both sworn and civilian, and also mental health and addiction services. I have learned that starting my business is not for the faint of heart. And so anyone out there who has done this, my hat goes off to you. In 2007-8, it was a pretty dark place for me. My children, adult children, had all moved out, started their careers and their families. And this is a good thing, but it was very lonely. Also, my relationship with my spouse was struggling. And after 18 years of a relationship, we ended up in a divorce. The economy tanked back in 2008. Many people will remember that. And my partner and I were very much affected financially by that. I was also dealing with my mother, who was ill at the time. And she was very ill with mental illness and addiction related complications. At her death, she disinherited me. But you know what? Ironically, that was her best moment. And sometimes that happens where we as first responders want to help people and it doesn't come out the way we thought it would be. Today I have no regrets. I tried to help her and I realized that I didn't have the power to do that. In 2008, also, in honor of a couple family members of mine, one who is a first responder and former first responder, I have volunteered for the National Alliance on Mental Illness, a local affiliate called the Valley of the Sun. I've been a teacher for them, a presenter, and a current board member. NAMI is a resource for anyone attending this webinar. NAMI is throughout the entire country, and we provide individuals and families with mental illness free support and education. So anyone on this webinar who wants assistance free of charge, please look up NAMI. How organizations do that is we have fundraisers twice a year. Our current fundraiser is coming up later this month. We don't want anybody to be denied the opportunity for mental health assistance, for resources, support, and information because they don't have the ability to pay. I have a friend who recently wrote me a message about how NAMI changed his life. He happens to be a sergeant, a retired sergeant at a local jurisdiction, and his comments were, "Thank you for introducing me and my wife to NAMI when our adult son was diagnosed with severe mental illness." And that is why today I now volunteer. This says a lot. We as first responder families are not exempt from having families members with mental health and addiction issues. The next one is a little personal, but I'm going to share it with you. I would not have done this as an employee in a law enforcement agency, so I waited until I retired to do so. But in 2010, I had developed a full-blown drinking problem. I was very functional on my job, and very few people knew. I could honestly tell my chief at retirement that I did not drink on the job, but I put myself through absolute hell by drinking alone in the crevices of my own home with the intention of not embarrassing my department or my peers. That same year, on my 50th birthday, I shared with my kids that I had a drinking problem and I needed help. And when I said the words out loud, the burden was lifted. It took all the power out of that. I came to the conclusion that alcohol no longer worked for me, but I also didn't want to be a burden to the department that I loved. I also didn't trust my department, even though I loved them, to get me help. So I decided, even as it's kind of odd, but even as a mental health professional, you would think that I would know what to do and where to go. But when it happens to you and when it happens to your own family, all bets are off. You're just another human being dealing with a very difficult problem. So I needed help and I wanted treatment and I didn't know where to go. So I just tried to do it on my own, which was a miserable experience for about 30 days. It's interesting because when I had my knee replaced, I didn't think twice about putting my colleagues out for a 4-week rehab. I went and got the surgery. I did what I did to take care of myself. But for some reason, this was different. A month later, I found myself in a 12-step program and recently celebrated 10 years of sobriety. Now, this is why I created my business. I want to help first responders and agencies make this process of getting help more seamless. There are some excellent peer support units in some jurisdictions, but in my opinion, they are the exception. I fully support peer support units and departments. Next, this is a little unique, not quite sure how I want to do this, have given it some thought. I desperately want to help our agency command staff personnel because they want to do the right thing for their people. I honestly believe that. They may be struggling with the how part, and I think there's a way around that, and I think I can be helpful. But I do not believe this is the end all. If my role in the department is worth $150,000, given supplies and salaries and all that, and that is what it costs to replace me, isn't it worth it to figure out a way to keep me healthy? My answer is yes. So more to come on that. Haven't yet figured that all out, but I really think there's a way to take care of our folks better than what we're currently doing. So between my business within reach and my current position as a clinical supervisor and first responder specialist at the RiverSource treatment facility, I get the opportunity every flipping day to help people who are first responders and the general public, either online, in person, in home, and their families. I also provide an online Zoom first responder AA meeting. This meets 4 times a month. My website is www.nataliesummit.com. It is filled with many vetted resources. People have asked, why do you include other clinicians on your website? And my response is that maybe they have something to offer that I cannot. And I want people to have options that I didn't have. At the end of the day, if I can help one first responder and their family, I have accomplished my new meaning and purpose in life. Thank you.
Right. Well, thank you, Natalie. So where are you going to take us today? What's your discussion going to be about?
Well, I'd like to take you on this pie chart, where I'd like to start with what is a first responder, and then I'd like to talk about how the community can help first responders, how first responders can help the community, how first responders can help themselves and help their peers and their families. So that's kind of where I want to go, especially during this phase of the coronavirus.
Okay.
Oh, do you want me to start there?
We are ready for you to go.
You're funny.
Okay.
Thank you very much. By the way, it's been a pleasure to work with both you and Laura, and also with Mark, who's not here on our screen, but I appreciate that. So who is a first responder? During the COVID-19 crisis, the definition of first responder has kind of naturally expanded to include the frontline medical folks too, as well as doctors, nurses, and EMS, alongside with our police and fire sworn and civilian personnel. I would be absolutely remiss if I did not also acknowledge all the other amazing people who are helping US citizens during this COVID-19 though. It is nothing short of miraculous how our community, our country has responded to this. Something so tragic, and yet people are really helping one another out in very simple and yet creative ways. Some areas of the country are hit very hard, and others are not. Arizona is has not been hit hard like some of the other areas, New York, California, Washington. So sometimes the whole coronavirus information can feel a little confusing. because of those of us who are less affected. This webinar is going to focus on public safety, but the information applies to all the other helping disciplines as well. And on that note, it is important to note that not all first responders and jurisdictions are created equally. So there are lots of different kinds across this country. And my hope is that we move through this webinar and I can capture and speak to as many facets of that first responder life as possible during this crisis without overwhelming anyone or offending anyone. That's my goal. First responders are human, and naturally we are social beings. Generally, we crave connection and the ability to give and get from one another. In this pandemic, no one is unaffected and no one is immune. We are continuing to learn about this relationship. And when I talk about relationship, I'm talking about the relationship between humans and the virus. And experts are trying to understand this relationship with the sole purpose to eliminate it. So don't freak out here, but we humans are indeed in this together. This is not the time for blaming or having conversations about us and them. This is not a political thing. This is how can we take care of one another during a crisis moment. So the first one I'd like to do is to include how can citizens support first responders. The reason I would like to go there next is because there may be citizens that are on here that are just curious, and I want you to know what you can do to help. And if you have to skip off the webinar, you won't miss this piece. That's my rationale there. If you are a citizen, you can be very helpful to first responders by simply following the rules and the directions that are provided. Be kind. And if you disagree with what is happening at the time, and that is your right as a citizen, take it up later with the first responder or their supervisor, but not at the moment. Now, why do I say that? Officers make decisions about their next steps based on compliance. So again, follow the rules. Law enforcement officers do not make the rules, they enforce the rules. And so when a citizen asks an officer for a special consideration based on their personal situation, that officer has to carefully evaluate and consider how that's going to be affected with the policies and procedures that they are required to follow. So if for a moment, if a citizen, you can be very helpful if you help a first responder by following the rules and following through. So let me, give an example of this. Consider that a public safety personnel person is responding to a call for service to your home or your location. And they're getting this call for service prompt either in the morning, at noon, in the evening, middle of the night, and it's an immediate response, readiness and go on the first responders portion. So I'm going to include myself in that process, having responded for 20 years out in the field on an on-call schedule, that we don't stop and evaluate, like, do I want to go? Is this a worthy call? How will this affect my plans today? I'm going to miss my kid's birthday party. Did I get enough sleep? Do they have the COVID-19? So those of us in first responder land, we're trained to ready, set, and go. And it's okay to say thank you to your first responder. Public acknowledgement is pretty powerful. And personally, I love to acknowledge people in a group. And when you acknowledge somebody in a group, it's very powerful. You can also send an attaboy or an attagirl to command staff, the chief of your police department. It's powerful. And letters written to command staff, they go into an employee's file, and they are very valued. Your moments of shared gratitude for first responders and their impact have lasting impact on people. Again, law enforcement officers are enforcing the law. They do not make the law. Follow the rules. Be safe. Be kind. and say thank you. All right, so my next little step, hope we're doing okay here. Hope everybody's on board. I'm not sure how many are in attendance, but I'll just proceed. I'm so pleased that people are showing up and want to learn how they can be a part and be helpful. So the next section I want to talk about is how first responders can help themselves. First responders are asked to do more and more difficult things all the time. They have been asked to help those with mental illness, with addiction, and then special needs. And now it's the coronavirus, one more demand to place on the first responder plate. Feeling stressed and overwhelmed is normal, and it's anticipated, and it's imperative that we acknowledge that feeling. If I say, I am exhausted, I am afraid, I am stressed, that is normal. We call this name it to tame it. Without acknowledging that, those thoughts and feelings, then it can take on a larger than life presence. That's not good. My concern is also that acute and chronic stress, they have very long lasting effects on the body and the mind, which can affect their long-term mental health. And so in global and national and focused crisis situations, we have a choice. We can look at how to reduce the stress, or we can promote resiliency in ourselves and our organizations, or both. Agencies across this country are hopefully addressing this very question. Laura, my right-hand woman, would you please show the picture of the book? I recommend an excellent book written by a former cop, Stephanie Kahn, entitled Increasing Resilience in Police and Emergency Personnel. She does a fabulous job of providing practical suggestions for police employees and their families and police agencies. It is one of those must-haves to have on your bookshelf. After long shifts, multiple days working traumatic situations can be the worst on the mind and body. I actually do not miss this part of my career in any way, shape, or form. I love getting a full night's sleep uninterrupted. Sorry, guys and gals. There are some critical recommendations that I believe you must do if you're coming off one of these shifts or events, is sleep. Sleep is so important. It is like fuel for your body. Your body is starved for it. Another is eating a balanced diet. Energy drinks and candy bars won't work for long term. Eat a balanced diet. Talk to someone who will actively listen to your concerns, what you have seen, and how you are feeling. When you are an active listener, you will be listening much, much more than talking. And connect with a support system. The support system may not be your peers. I have seen some of the best first responders who are healthy have very separate lives between their personal and their professional life to keep that balance. Other steps to do are to look and assess at what you have control over, or what's a realistic expectation given the circumstances. If we don't have control over something, it is my advice, let it go, let it go. I think there's even a famous Disney song, let it go, let it go. It is counterproductive to focus on things that you have no control over. It will just take you down so fast. Disengage and take a break. If you don't do this, you run the risk of where your head and your heart, they kind of separate because they're not connected. And remembering that you were put exactly in the right position and exactly to do the job that you're doing to do amazing things in the world. You are an asset. And when I talked about earlier in my introduction, I was an asset. I was worth money. I was an asset. It's important to take care of yourself. Do something that fills you up and feeds you. It's really tempting to want to take on these really long calls and traumatic situations that go on and on for days. They're great on the pocketbook, but they are just so unhealthy to do. And to kind of counter that with some the musts that I recommend: sleep, eat, talk, and connect. I also recommend doing things that fill you up, like gardening, hiking, playing a game of scribbage or ball, or whatever it is that you're in. You know, the sweet spot for us who are in the field is the balance. The balance between personal and professional, the balance between too much and not enough. It's in the balance. That's the sweet spot. I also recommend that you ask yourself, why do you do what you do? Go back to the day you applied. What is the meaning and purpose? Once you can identify, it will be easier to do the not so fun parts of your job. It's important to connect with good, supportive people. And I have seen this happen multiple times. It's not unusual. It happens everywhere in first responder land. But negative, gossipy, trash talk doesn't help anyone. Please try and refrain from that. It's not helpful. So that's a quickie on that. I guess that's it for that. The next place is how first responders can help peers. Do you want me to continue, Neil?
Let me ask you one question.
Sure.
Natalie, because the men and women in all these first responding units are working with each other. Is there anything, if I see one of my peers struggling, having a hard time, is there something I should do? Some way that I can personally help my peer that's struggling during this very difficult time?
Oh, that's wonderful. And that's where we're going. In my experience working in the public safety field, what I've learned is that first responders naturally want to help others, but we often stumble with how to help one another. That means our peers, our employees, our staff, for a variety of reasons. And that's a whole nother webinar, but let me give you some recommendations. I would call them critical recommendations. Here's the first one. Remember I said that I was forthright in my introduction. Number one, stop judging yourself and your peers. We are the most critical people of ourselves and others that I've ever encountered on the face of this planet. And because we are somewhat of a closed group of people for a lot of really good reasons, we also have a tendency to turn on one another. Part of that is survival, but it doesn't matter. Stop. It is hurtful. It's not helpful. And it creates long-lasting resentments that can take on a life of their own. So stop judging yourself and stop judging your peers. These are difficult times. Any difficulty we have is going to become magnified during this period, and it's going to become more apparent to ourselves and to others. The next one is I'd recommend listen with the intent to understand your peers who are having a difficult time. For years, I provided instruction to first responders, and I learned very early in my training that when we feel powerless, we tend to say and do stupid things. I learned this a lot on working with cops and training them on how to do death notifications, because it's not a fun thing to do, and there's a skill behind doing that well. But the key is to just be present and to listen and be present during that period. If you know that a peer is struggling, it's important to actively listen. You'll know that you're actively listening if you understand what they're saying. You may want to ask, how can I help? You may want to ask, do you need the number for peer support, or do you know where it's at? My third one is to encourage a peer to reach out to a professional or a faith leader. Some people choose to go to a faith leader over a mental health professional. Doesn't matter, just reach out. And the other thing that kind of puts officers and other first responders at risk is that many people get into the field because they're kind, they're compassionate, they're empathic for the human race. And this is the very same thing that puts them in the risk category for their own anxiety and depression. Not to say that there's a linkage, but you know, that's what happens for people who are empathic. They take on a lot of that. So it's important to also just reach out for help. This is a big one. I know, coming from a person who is in sobriety, it might sound, I don't know, something, try and forgive me. But it's also coming from somebody who understands firsthand the desire to numb with alcohol. But encouraging people to drink during times of stress is not recommended. First responders have a tendency to kind of overindulge in a couple things. One is alcohol, some is pain meds if they're hurting really bad, and then also sex. Each one of these threes has an impact on families as well as the individual. Please don't encourage drinking. The last one I recommend is to deploy patience to both yourself and your peers. I like to do a good job, but I'll give you an example right here and now. I'm not perfect. This webinar is not going to come off perfect. I'm doing the best that I can. I might not know the answer to something that Dr. Neal is going to ask me, but I'm going to try my best because that's my job. Reminding people that it's okay not to be perfect. First responders tend to follow the rules by nature. They adhere to this paramilitary structure and commands, and they practice and they deploy skills because that's how they save lives. First responders, they appreciate and respect authority and discipline and integrity and protocols and orders. The citizen community doesn't typically understand all that. But if you come from that mindset, and then in walks this COVID-19 that is just covered in fear and contagion and confusion and misinformation and lack of information, this can be unsettling, to say the least. So in answer to your question, how would you help someone, is just be mindful of your peers, but to also review here, please don't be in judgment. Listen with intent to understand. Encourage a peer to reach out for help. Do not encourage alcohol intake, and deploy lots of patience with yourself and others.
Okay. Let's take it one step further. What about specific recommendations from the highest leadership, the strategic leader, the executive leader in the first responding community, a police chief, a fire chief, chief of EMS? Anything specific they should be doing to help us all through this coronavirus experience?
Yes, this is my opinion. I believe fully in the depths of my heart that our top staff persons have every intention and interest to be helpful to their line staff and employees, both sworn and civilian. Kind of like a parent. A parent wants to wake up every morning and be the best parent they can have. They don't have the intention of messing up their kids. And oftentimes that happens through miscommunication or whatever. Life happens, okay? But I believe that our top staff has an interest in doing that. It's a difficult spot for them to be in. And so I encourage the very same recommendations for our peers with our command staff, but also our command staff with our line level staff. For example, don't be in judgment so quickly. Listen with the intent to truly understand what is happening with your line staff, the people, the boots on the ground. Encouraging them to reach out for help without ramifications of being in trouble. Not encouraging alcohol intake applies as well, and to employ a lot of patience and be open. I think there's space here to help people at the top. I think there's willingness. We just have to find a way that they can do that and be accountable to those that hired them to do the job that they are hired to do, and also to the people below. It's really a thankless task. but it is very important. And I'm dedicated to figuring this out. I liked my chief. I didn't always disagree with him, but I liked my chief. He was a good person and still is a good person. That's my comment to that.
Okay. All right.
So the last one I had was, how can first responders support the community? And I think that's my last one. Laura, can you check me on that while I'm continuing on? As a first responder, ask yourself again, what's my purpose right now, right here, and stay focused on that. Every day, first responders give well-meaning advice to the community. Lock your doors. Don't leave your garage door up. Be mindful of your surroundings. This is just one more thing you're adding to that bag of tricks. Is if you don't, it is please be safe. Follow the rules. Experts are working on this. When they give us recommendations, we need to follow the recommendations. Also, know your resources in your community. Every community has their own crisis systems. Crisis systems are the living, breathing tool of every officer across this country. Crisis intervention training that came out of Memphis in 2018 has taken our first responder response to special populations and special events and people who are in need during crisis situations to a whole new level. It's amazing. Everybody wins here. So know the resources for the crisis services in your community and freely pass that on. Give hope. Give hope to your citizens. You can say, you're not alone. We're in this together. I'm helping you to get safe. What I need you to do is follow the rules. And again, it's okay to say thank you to our citizens. Thank you for doing this. Thank you for doing that. Thank you for acknowledging me as someone who's been helpful today. Thank you for being a part of the solution and not part of the problem.
Natalie?
Yeah.
How about police families and fire families?
That's the one I forgot. The one that's really important. Thank you. I knew somebody would keep me on track. So the first responder family. I do have some suggestions here. And that is that ease the stress at home. Openly dialogue with your partner about your feelings, your needs, and your wants. And hang on tight to one another. There's powers in numbers. And if there's the two of you, you got two of you. Have a what-if plan. We don't know where this is going, but have a what-if plan. Be a good role model. Our kids are watching us. Kids are watching the adults in this world. So how you respond to something, for example, it can be a family death, it could be a divorce, a birth, a tragic accident, it could be managing a physical illness, a mental illness, an addiction, a job loss. Kids are watching, they're observing. And then it's, Google, inspire mental wellness and creativity. I have seen some amazing things on Facebook and other social medias where creative Americans have come together to involve their kids in getting creative. One of my favorites is a gratitude box, and I wanted to show you mine, but it's in the other room. And a gratitude box is something that you have that you can envision. You just kind of put things in that you're so grateful for, and kids can do this too. And then you can review it over a meal, or you can review it at the end of a night. Gratitude actually builds and creates new neural connections in the brain, which is a good thing. It is important to acknowledge that children are under significant stress right now. And some of them may not have the language to be able to tell you this. So you're kind of left with looking at their behavior. And some kids are not so quick to respond behaviorally because they're still kind of assessing the situation. So you might be surprised by their behavior, you may be not. But looking at a child's behavior can be very telling. And actually that applies to adults as well. We in the mental health profession often look at what's changed, and that gives us a good idea about what's going on. And then the second great question is, when did it change? So we can get a starting and an ending point for the change that has occurred. Most importantly, reassure your children that they are safe. Thankfully, kids are very resilient. Ask yourself this wonderful question, and it is, in 5 years from now, what do I want my children to remember about COVID-19? And more importantly, what do I want them to remember about me as their parent and how I helped them get through this time? That is a profound question to ask yourself. When you have the answer to that question, you will know exactly what to do for your family. While creating this webinar, I had a pretty significant response in this section. And that is probably because I am a single person. And that is because not all first responders have either a healthy family to go home to, or they're going home to an empty house. Please check on your brothers and sisters in public safety who are alone. They too need our support, and a phone call and a text can be super helpful. Thank you.
Okay. Natalie, before I open it up for questions from the floor, I know that you've done some significant work on moral trauma.
Oh, yeah.
Do you have a minute or two to talk about that before we open it up for questions?
Yeah. Miss Laura, can I get that slide? Thank you. I've had an amazing opportunity in my career with law enforcement to present with a friend and colleague, another officer by the name of Daniel Antrim, who has since retired. But he and I did a kind of a dog and pony show for numerous law enforcement opportunities, and specifically with negotiation teams across our state. But there are two things that come up that I want to talk about. One is moral injury. Moral injury actually dates back to the Vietnam War. It's not new. I didn't create it. What Dan and I did is we took it to a different level and applied it to the first responder world. It's an injury when individuals violate their core moral beliefs. And this is the key, and in evaluating their behaviors as negative, they feel they no longer live in a reliable, meaningful world and can no longer be regarded as a human being, as a decent human being. So they question their worth. So how this might happen to a citizen out there might be that you're driving a car, your car malfunctions, it jumps the curb, and it hits a child and a parent that are on the sidewalk. So the individual driver is not at fault, has done nothing wrong, and in the process, a child is killed, a young child is killed. So that moral value that got questioned there was, I don't kill people, which is most of us. The negative piece is that individual might feel, but I did, and because of that, I don't deserve to live, or something of that sort. That is moral injury. In a law enforcement or first responder setting, moral injury can happen when someone is commanded to do something that they are in disagreement with, don't think is the right thing to do, and someone gets hurt in the process. This happens all the time in the battlefield, and people get killed, and then the soldier is left standing going, oh my gosh, I killed somebody. What does that make me as a human being? Worse yet, it was a woman or a child. This does happen, It falls into a category associated with post-traumatic injury. Moral injury, if done correctly, is very curable. And the cure is finding someone who can walk them through this process in a very non-judgmental way. That's the beauty of getting help for moral injury, so that there's no long-lasting effect. Betrayal trauma is a little bit different, and this is defined when trauma is perpetrated by someone with whom the individual is close to or reliant upon for support, survival, and resources. This can be a person or an institution, and it is accompanied by broken trust. Now, again, I'm going to give a civilian perspective. Someone is sexually molested by a family member, specifically a parent. That would meet this criteria where the trust of a parent is definitely betrayed. Now, this is unfortunately common. This is not only a law enforcement or first responder thing. This happens in organizations across our country and globe. But it does happen in law enforcement as well. It tends to happen in areas where there's a trickle-down effect, where resources are limited and personnel are very, they're a necessary service. But this can happen where someone is primed to take on a new position, take on a new task, and for whatever reason that is shifted at the last moment. And there's all kinds of reasons that this happens. I'm not here to justify or not justify that, but what I'm saying to you is betrayal trauma is real. It happens for first responders out there, and it can really stunt somebody's professional opportunities in their career and to maintain their meaning and purpose in moving forward. Betrayal trauma is also curable with the proper person to help with that process.
Okay. Thank you for sharing that with us, Natalie.
You're welcome.
If you have a few minutes now, with the help of Laura, I'd like to open it up for any questions that the audience may have for Natalie, and we'll see where that takes us.
Hi, Natalie. This is Laura. One of our participants had a question about supporting first responders during this time in regards to donations and things like that. Is there a best practice when it comes to reaching out via your community or looking, what did this person say, looking at different organizations? Because unfortunately there are some scams running right now, and I think this question is around where to go, how to directly impact and support these first responders. So can you speak to that?
Yes. I guess my response is that every jurisdiction is going to be a little bit different. Every community is going to be a little bit different. There was a post on Facebook this morning for dispatchers where they were people wanted to help dispatchers as well, and so it was kind of like, well, what are we able to bring into the room? Like, can we bring in food to the room? Can we have contact with these people who want to help out? What's the best thing? So this is a tough one because it might not be the in-person stuff that we would normally think of. It could be that now is not the right time. I would suggest if a citizen was very interested in helping out their local jurisdiction, that they call that jurisdiction and see what their needs are and how to provide that need to that organization, as it would probably be agency specific.
Great, thank you. We have another question that just came in. I'm a correctional employee that works in a community-based facility. Do you have any information that can assist correctional employees during this situation? Correctional employees work in a different environment than other first responders.
Thank you for that question. And I have learned a lot about working with correctional individuals in my practice. And you're right that your services are a little bit different to the community. And I want to thank you for that. Are you familiar with corrections1.com, I believe it is? They may also have something on that website. But many of the same things apply. The challenge is that you're so close together. The proximity is continuous and right there together. Take care of yourself first. You cannot help anyone else if you cannot take care of yourself first. Sometimes it's embarrassing to do the things that are recommended, like masks and PPEs, and thank God I hope you have some. But just take care of yourself first. I'm sorry, I don't have a super great answer for that. That's a difficult question.
Okay, I think those are a great couple questions that we started off with. Natalie and Neil, would you prefer to move towards the poll at this time to show the needs of our first responders?
Okay, I didn't capture the question there, Laura.
I'm just asking if you two would like to launch the poll now, if you'd be okay if we put that out there.
Yes, let's launch the poll, please.
Okay. For those attending the webinar, you should be able to see on your screen a questionnaire. It states, I know a first responder who is managing or who has coped with one of the following. It's a multiple choice poll. The first is post-traumatic stress disorder. Second, depression and anxiety. Third, job-related physical injuries. Fourth, drug and alcohol addiction. Fifth, moral injury or betrayal trauma, which Natalie has just discussed, and that slide is still up. Suicide and other.
Thank you for doing this, Laura. I'm really curious to see the results.
Yeah. We'll give people a little bit longer to look at that. Okay, we're going to go ahead and stop this poll in just a second, and we'll be able to look at each of these situations that a first responder may be coping with or managing to see where their needs are and take some of the things that Natalie and Neil have discussed and see how it can be put into practice for them. So it looks like the one that was rated the most frequently was job-related physical injuries. Natalie, can you talk a little bit about job-related physical injuries and how that can maybe cause some mental illness, stress, lead to problems down the road for our first responders?
I am not at all surprised by these percentages at all. So let me grab this on two different levels. When we experience job-related physical injuries, everything that we know about our purpose, that meaning and purpose about doing what we do, is now in question, and that can be very disrupting to the ego, our ability to function and provide for our families. What's also interesting here is the three top addictions for first responders are alcohol, pain meds, and sex addiction. So when you look at this 75% for job-related physical injuries, I'm wondering if there's connection to pain meds there and developing addiction. It wouldn't surprise me.
Are there any other numbers on there to you, Natalie, or even for you as well, Neil, in your experiences where you see trends within either the first responder or even the law enforcement industry?
But I think I would like to maybe tail in on what Natalie just discussed. I mean, obviously, I've lived in the police world all of my working life, and I have seen peers who have been physically injured, and in many cases, if it's a life and death encounter or perceived as a life and death encounter, it will carry over into probably the post-traumatic stress injury and the depression and anxiety level as well. I mean, I can think of two good friends that left policing after life and death encounters, and their behaviors in hindsight would clearly demonstrate a sense of depression and the fact that they had suffered post-traumatic stress injuries from the physical encounter. So I think there can be a connection to the top three things on that list, but I am not a counselor as Natalie is, and so I would defer to her wisdom on that.
Mm-hmm. No, I would agree with you. When we talk about post-traumatic stress disorder, we probably also need to include post-traumatic stress injury, which is a little bit easier to hear. Depression and anxiety, it's rampant. It's absolutely rampant among our first responders. It's just a natural evolution from the trauma on the job. Those are the top three, those that are listed there: PTSD, depression, and anxiety, for the top three mental health disorders known in the first responder industry. I am not surprised by the 42% who have either experienced or know someone who's experienced moral injury or betrayal trauma. That to me is a leadership challenge. To make change there, it has got to come from the top down. And of course, we have very sad statistics reference suicide. 34%, that's high.
It is high.
That is super high. I mean, I just got goosebumps high.
Natalie, we actually just received a question. My department does not have a peer support group. Do you have resources that would be beneficial or information on how to start a successful peer group to get the support from administration? Well, first of all, anybody who has any questions about resources, truly my website has a lot of resources listed. I did that purposely so that I could always refer to it, so that it was always available to people for all kinds of things. Some of them are Arizona-based, many of them are not. So please go there. There is a Public Safety Peer Support Association. I think I got those acronyms correctly there. Public Safety Peer Support Association. I would recommend joining that as a first responder and finding out your next steps there. They would guide you with everything that you need. They also have a conference every year. The trick on a peer support group is what makes them successful is there has got to be trust with the person responsible for a peer support group. It's really hard to find someone in a department that is trusted by most employees. But there are some people out there who can fit that bill. Those are the people you want to put in charge of a peer support group, not somebody who's waiting for retirement and kind of taking up a position. Great, Natalie. I think those were all of the questions that we had for the moment, and thank you so much for giving the feedback from the polls. So I will leave it up to you and Neil to wrap up with last points or takeaways from this session.
Natalie, any parting thoughts?
Be safe, be kind, say thank you, be patient with yourself. We are not perfect. This is not perfect, but we're all doing the best that we can to help one another.
Okay, thank you very much, Natalie, for being with us today. Ladies and gentlemen, thank you for joining this webinar. We look forward to having you join us again next Thursday. Please watch the FBI-LEEDA website for the registration and how to get into that the next webinar. We are hosting these throughout the month of April. And for those of you who are FBI-LEEDA connected, please continue that connection. For our Trilogy graduates, those that may be tuned in, please, congratulations on having that honor, and please continue to be great supporters of FBI-LEEDA. And we look forward to continuing to provide educational outreach during this period of time and hopefully well into the future. So thank you very much for being here.
Thank you, Neil, as well as Natalie. Thank you again for everyone who joined us on this webinar. For more information about FBI-LEEDA, please feel free to visit us at fbi-leeda.org. We are also on Twitter, Facebook, Instagram, LinkedIn, as well as we do have a YouTube channel. We will be posting this webinar to our website and our social media platforms for anyone who may have missed it and for those who would like to go back. We will be posting some documents based on what we've covered this afternoon with Natalie Summit from Within Reach Summit Consulting. Any questions and concerns about her program that she has available with her consulting, or questions specifically for her, please visit nataliesummit.com. Thank you very much, and everyone, please stay safe.
Thank you.
Thanks.